Hello everyone, and welcome to this audio podcast. This audio podcast today is part of a Storm Depiction. This audio podcast is part of a bolder project. This audio podcast as part of the journal. This audio podcast is part of a Storm and Ostix D note. And that's this audio podcast as part of a Storm and Ostix production. In this audio podcast, as part of this audio podcast, looking at an article publication, a sort of a literature review, a publication by Mohammed and team from in around 2021, looking at education empowerment and practice excellence, a practice review, and when the publication looks at in around the research gap and approach, in around the research questions and strength, and around the strength and limitations are in of the publication. So the publication looks at where the looks to prompt an overview of if and whether it would be advantageous to have multidisciplinary team MDTs in online or sort of educational consultations through the RPSG platform. And as part of the sort of research question, the publication formed a review that looked to inform whether it would be advantageous to involve MDTs, multidisciplinary teams, through online consultations and/or educational consultations through the RPSG website, to improve practices and health literacy for CKD recipients. The publication looks to understand if it would be helpful to have follow up online consultations with MDTs for healthcare following kidney care appointments. The publication is within the remit of social media use or use of social media and the remit of the use of social media, the and as part of patient and public involvement. As part of the strength of the publication looks to understand healthcare sort of education, understand healthcare education, and in around sort of the basis of this. The publication informs of how patients and healthcare professionals, should be looking to collaborate to bridge challenges for CKD or in on CKD and disenfranchised populations. The publication also informs of how use of user-friendly and interactive healthcare educational services is also important for knowledge and resource. In as part of the limitations, the publication informs in on only some aspects surrounding in on social media use or use of social media, and in on how social media could be integrated in context of online consultations, and how this could help achieve integrated services for uh, for uh, for uh, for healthcare service users, for example, children and young people suffering with different forms of kidney disease. The design of the publication should have included an example of how the RPSG online services could help patients and healthcare professionals to attain more informed understanding surrounding kidney care services. That draws this audio podcast to a close. This audio podcast is part of a Storm Depiction. This audio podcast is part of a bolder project. This audio podcast as part of a Ztorm and Ostix D note, and this audio podcast as part of the journal, and this audio podcast as part of a Ztorm Lobostics production.